I am Dr. Stephen Potter. I'm a transplant surgeon and the Director of Pancreas Transplantation here at MedStar Georgetown Transplant Institute. My specialty is transplant surgery, and I specialize within that in the transplant of the pancreas, kidney, and in living donor kidney surgery. The most rewarding thing about my practice is transforming and saving lives through the act of transplantation. It's unbelievable to see people get additional years to spend with family and loved ones, go to school, go back to work after transplantation. I feel extremely fortunate and grateful every day to help people get off of dialysis and get back to their lives. I am so grateful and lucky to have an amazing team to work with. Our team is dedicated to transforming lives through transplantation. They come from diverse backgrounds, diverse specialties, but they all show up every day with the same mission in mind, to save lives through transplantation. The transplant team here at MedStar Georgetown Transplant Institute is really phenomenal. I get up every morning excited to take care of patients. The art and science of transplantation is amazing, and the ability to help extend and save and enrich lives through transplantation is a good reason to get out of bed every morning. I can't think of anything better to do. People should consider pancreas transplantation if they're diabetic and on insulin, particularly people with brittle diabetes who have a great deal of problem controlling their blood sugars, people whose blood sugars are still out of control despite optimal medical management, and people who have hypoglycemic unawareness, which is a very scary problem where people don't know that their blood sugars are getting very low. The benefit of pancreas transplantation is that it's a cure for diabetes. In other words, it's a way to get off insulin, not require any additional insulin, and it also can reverse early changes of damage to nerves, eyes, blood vessels that are so common and so devastating in diabetes. Controlling what you eat and how much you exercise is critically important for correctly managing your diabetes. There is no perfect solution for diabetes. The only way to cure diabetes is a pancreas transplant. But if you're not careful with your diet and you don't take good care of yourself, it becomes very difficult to be fit enough to undergo transplantation. We have people at MedStar Georgetown Transplant Institute that will talk to you about your diet, talk to you about your insulin, and help prepare you and optimize you for a transplant. Pancreas transplantation may be the best option for patients with type 1 or type 2 diabetes. Historically, most patients who got a pancreas transplant had type 1 diabetes, but increasingly we're evaluating type 2 diabetics as well. In particular, patients that have brittle diabetes, frequent problems with low blood sugars, frequent problems with very high blood sugars, or diabetic ketoacidosis or coma can benefit enormously from pancreas transplantation because it's a way to cure their diabetes. Most of our patients who get a pancreas transplant also have end-stage kidney failure or advanced chronic kidney disease. So those patients get a simultaneous kidney and a pancreas, which is a way to cure both the diabetes and their kidney failure and get off dialysis. Needing a pancreas transplantation is not your fault. Diabetes is a horrible disease, and pancreas transplantation is a way to cure diabetes. What you can help with is getting your diabetes in as good of control as possible so that you're as healthy and as ready for a pancreas transplant when the time comes. The two major avenues to go forward and get a new life if you have diabetes and you're a candidate for a pancreas transplantation are to get a simultaneous pancreas and a kidney transplant from a deceased donor. The other major option is to get a living donor kidney transplant and then proceed to get a pancreas after that when you recover from a deceased donor when one comes available. People who have years of dialysis time and don't have a living kidney donor are typically people who should consider simultaneous kidney and pancreas transplantation. The patient who's been waiting on dialysis for years will get that waiting time applied to them when they get on the list, and they can often get transplanted with a pancreas and a kidney very quickly. Patients who are new to dialysis or have not yet entered dialysis, and anyone who has an identified living kidney donor can avail themselves of that incredible gift of life of a living donor kidney to get off dialysis right away, to start living a new life, and then they can come back and get a pancreas after that kidney transplant down the road. If you're interested in getting a pancreas transplant, you can call us at MedStar Georgetown Transplant Institute at 202-444-3700. The other thing you could do is just Google MedStar Pancreas Transplant and click the link for an evaluation that appears at the top of your page. We see many patients who've been evaluated at other transplant programs and told that they're not candidates. But we would encourage you to be evaluated here as well, because we are a very high volume, high quality program, and we routinely do things that other transplant programs don't. So we would like to see you and see if we can assist you. In order to get on the waiting list for a pancreas transplant, you'll need to undergo an evaluation by our multidisciplinary team. Our goal is to make sure you're as ready as possible for your transplant when it happens. We'll need to evaluate your physical well-being, your emotional well-being, and your ability to follow a relatively complex medical regimen after your transplant. I think my favorite question to hear from patients is, how can I best prepare myself for transplant? Because it tells us that this person is really engaged in their care and wants to do well. We're here to partner with you on that journey, and we're always cognizant of the fact that you have the really hard job and we have the easy job. To best prepare yourself for a pancreas transplant, you need to take good care of your diabetes, you need to manage your weight, you need to try to stay fit and active, and you need to know your medications and take them appropriately. It's important to have adequate support for after your transplant, and we'll ask you about those things when you come for your evaluation and try to help you with all those issues. At MedStar Georgetown Transplant Institute, we want to partner with you after your transplant, not just at the time of your transplant. That partnership means that we ask a lot of you, and we know we do that. You need to take a lot of medicine, you need to make your follow-up visits, but the key thing is to remember that we want to help add years to your life, and we want to enrich your post-transplant experience and optimize how you do. There are common sense dietary restrictions after transplant. You can, for the most part, eat whatever you want, but in moderation. So your diet is much more liberal than it is before the transplant because you no longer have diabetes. Recovery after a kidney and pancreas transplant is a lengthy process, but it gets a lot easier very quickly. Patients typically spend 5 to 7 days in the hospital, and when they go home, they're eating, walking, and doing really well. Typically, they're already off insulin, and they have to come back and see us in the office for close monitoring of their new organs. The frequency of those visits goes down dramatically over the first couple of months, and really by month 4 or 5, patients are typically back at work or have re-entered the workplace if they weren't working before, and they're spending time with family and friends and doing really well. People often ask us, what's the best way to take care of my newly transplanted organs? And we love to hear that question because it means those patients are invested in their care and they're going to do well. We partner with patients to help take care of those organs and to help take care of the patient and really by extension their families. Some things after transplant are really beyond the control of the patient. For example, early rejection or certain types of infections. But there are many things that are within the control of the patient. And that includes taking your medicines, making sure that you stay on top of your prescription refills so you don't have any gaps in dosing, and partnering with us at the Transplant Center so that we hear about your concerns and your questions. If you're thinking that your medicines aren't getting along with you, if you have questions or concerns about anything, we want to hear about that so that we can identify problems early and help solve them. As a patient who's a candidate for a transplant, we know you have choices about where you can receive care, and we want you to get the very best care possible. I think you should pursue transplant at MedStar Georgetown Transplant Institute because we are a high volume program that delivers the very highest quality care, and we do it in a way that treats you as an individual, not as a number.